Dr. Rucha Mehta, of course, she's a very well-known speaker. And for today's scientific Olympiad, we have got a super topic with a super player. And it is a pleasure to introduce Dr. Rucha Mehta. She's an endocrinologist practicing and helping patients in Bhat Circle, Ahmedabad, Gujarat. Practicing since 25 years in diabetology and endocrinology, working at Apollo Hospital. And she's done her studies in US. So I welcome Rucha without wasting much time. We want to hear more from you.
Great. Thank you so much, Alka. I think I'll just correct one thing on the slide is that if I'm practicing for 25 years, I must have been doing intermittent fasting forever because I look like this. So we'll talk about how intermittent fasting adds to your age and longevity and maybe everything else also. So let's go ahead and I'll just start screen sharing. Perfect. Okay. So first of all, thank you very much. And since I do have to spend 1 second on this to say congratulations to my great friends, Neeta and Sanjay, for again bringing to us this beautiful conference. And it's a great pleasure that we are starting off with nutrition because I'm a firm believer in nutrition as a medicine. Secondly, Shilpa was here just to host us and I have great friends also chairing. Importantly, this is also Nutrition Week, National Nutrition Week. So it's a good idea to start off with this topic. And my topic for today, as the name suggests, and most of you must be wondering, why are we speaking on intermittent fasting as an endocrinologist? So I bring to you a different twist. What are the pros, cons, indications, contraindications, and can you use it? For whom should you use it? So I don't know if I wish this was a real conference and I could ask if anybody recognizes this fellow over here. He's not that great looking, but just in the interest of time. So this is the CEO of Twitter, Jack Dorsey, and he became very popular when he started doing these very highly restrictive fasting methods. So he would almost go as crazy as eating only once a week. So I call it crazy because not all of us can do it. He did not think he was crazy. And certainly he's the CEO of Twitter. So we can't say he's crazy. But he continues that after several years of losing weight, meditation, watching what he eats. So it's not simply that he restricts himself, because I'm just trying to get to you what is the concept of fasting. So he eats 7 meals every week and he only eats dinner. That's what Jack Dorsey has to say. It gives him clarity of mind and great physical and metabolic health. I'm sure all of you, or most of you, at least the men in the audience, know these two ladies. So we have the two Jennifers. It's a day of two names, I feel, because we also have a lot of two names in the faculty today. This is Jennifer Aniston and Jennifer Lopez, very famous, and both of them say the secret to their success and looking good has been following intermittent fasting. Again, many other things that made this a hype. So something Dr. Michael Mosley came out with the fast diet, which was a 5-2 diet, wherein you fast for 2 days a week out of 7. And that's when you really restrict your calories. And that seemed to make people lose weight. So that is the key word. All of this usually starts off with wanting to lose weight. Now, what I'm going to do is also switch gears and make you understand that this is not a new concept. Why do people fast? We know that in India, people fast for several religious reasons. For example, where I live in Gujarat currently in Ahmedabad, and I practice at Apollo and also at my own clinic, we have several Jain patients. And today marks the first day of a religious 8-day fast for them called Paryushan, wherein they will go on to eat only for a certain amount of time. So they will actually do a time-restricted fasting for 7 to 8 days. So people fast for religious reasons. As doctors, we know we ask patients to remain nil by mouth if they're coming in for a surgical procedure. And we're always surprised, oh, the sugar looks great the next day. So does it work acutely? Does it have long-term benefits? And again, from nature. So anybody know what kind of penguin? This is the king penguin. The king penguins, along with their little babies over there. So they do it as a motherly act or a fatherly act. They do not eat for the entire winter month. They store food in these big bellies and they can go entire 5 months without eating. All they do is they use the stored food in their bellies to sustain their little babies so they can grow on. So isn't this simply fascinating, and don't we need to understand more as to what are the benefits of this fasting method? So why the hype? Because it seems to make you lose weight, controls your diabetes. It seems to promote overall health along with beneficial factors for your heart health promotion, cancer prevention, anti-aging, inflammation reduction. It seems to be the panacea. Is this the magic bullet that we've been waiting for? So let me try and answer these questions. I have no financial disclosures for the purpose of this talk. So I will go through what is intermittent fasting, what are the various types of fasting, what are the mechanisms. I'll try to keep that simple, and what are the effects on certain disorders that we look at. I will not be able to discuss everything that is out there, of course, but I will certainly discuss the pros and cons at the end. So what simply put it means is it's a period of voluntary abstinence from food or both food and water or drinks. And this is done intermittently. That is known as intermittent fasting. So contrary to what the name says, you don't fast intermittently, you actually eat intermittently, and you're fasting for the majority of the time. And this is very different from what we know, that calorie restriction, which seems to work very well for longevity, in which the daily caloric intake should be reduced forever, chronically. But the meal frequency or the duration of meal timing can be maintained. So these are the various intermittent fasting regimens that we've heard about. So you can have, number one is the alternate day fasting. So you eat one day, and the second day you have a low calorie day with a restricted zone timing, or you just have a complete alternate day fasting with no food and water. Then we have several other modified fasting regimens. The most popular of this seems to be the 5-2 diet, which involves severe energy restriction for 2 non-consecutive days per week, and you can eat ad libitum for the other 5 days. Now, what has become very, very popular, of course, and that we talk about a lot, is the 16-hour to versus 8 hours fasting, which is time-restricted feeding. And this allows you to eat within a specific time frame, whereas you're not going to eat during the other hours. Of course, we just mentioned religious fasting, Ramadan fasting, Paryushan fasting. So we have several other forms of fasting. Now, let's focus on the topic of the matter today, which is intermittent fasting. And what happens to the macronutrient composition? This is not suggested. This is what is observed, because usually in fasting is not a meal pattern, it's a feeding pattern. So in the intermittent fasting, what you usually allow in the alternate day fast is that 24 hours you can eat, whereas you have a 24-hour alternate day water only fast. So complete fasting every other day is very restrictive on the alternate days. The 5-2, as I mentioned to you, is a 2-day fast with very low calorie consumption, generally about 500 to 700. And for 5 days, you can generally allow the patients to eat what they want to. The time restricted, as I mentioned, is from 12 to 18 hours fast and a 6 to 12-hour eating period. And then there are several modifications based on the patient's comfort level. You can go ahead and do this. So this is very important to keep in mind, that this is sort of what we are doing. Now I'll focus on the 16-8 method, because that seems to be the one that's most popular out here. So what you see over here is just showing you for the 7 days of the week. You would ask the patient to begin his first meal by, say, noon, and that could be breakfast or it could be lunch for some people. Generally, the last meal has to be 8 p.m. or within an 8-hour window. And the remaining time when they are fasting, they can have non-calorie beverages such as water, lemon water, something that will not stimulate your insulin and other hormone release. So for example, a sample meal plan would look like you wake up and you have green tea or simply warm water. First meal at noon can either be breakfast or a big brunch. And then you can have a lunch at 2 p.m. Most people eat about 3 meals in this window, but some people might eat small meals every 2 hours. 4 to 5 p.m., you could have a tea, coffee, or a light snack. And you need to complete your dinner before 8 p.m., which could be, again, either light or a full meal. So this is sort of what a sample meal plan for 8 hours eating and 16 hours fasting looks like. So the question behooves us is, why is it working? How is it causing weight loss and such important outreaching factors on diabetes, heart disease, etc.? Is it simply because you're going to eat one meal less, calorie restriction, which we already know works very well for weight loss? Or is it something happening to the metabolic switch? Are we causing a metabolic switching? So let's look at some of the mechanisms. Now we know very well from Dr. Ramachandran's study that there's a strong association between weight gain and diabetes. As the weight increases, the percent diabetes also increases. Similarly, we also know that if you lose weight, you will reverse or reduce your chances of going on to diabetes. And generally speaking, for diabetes improvement, you need a weight loss of 5 to 7%. What we also know from the Look Ahead study is that participants who lost about 5 to 10% of their body weight using an intensive lifestyle protocol had improvement in markers of CV risk. So bear in mind, for A1C reduction, 2 to 5%, or improvement. But if you want to see improvement in CV risk, you might need longer data and higher weight loss. So what happens in fasting? Is it simply a weight loss or there is more? So I'm going to look at some of the metabolic markers and try to stay on this slide with me. What I've done is in the next slide, what I'm going to speak, I bullet pointed it. Since it's a virtual conference, you could take a photograph of that. Or just simply I guide you to the article in New England Journal of Medicine. So once you start fasting, means there is no food coming in. What happens is the first source is your liver glycogen starts to break down. Once you are done with the liver glycogen, using that in about 4 to 6 hours, you will start breaking down free fatty acids from the fat cells, and these are mobilized and they go into the liver. And now these are being used to generate ketone bodies. The predominant ketone body as tested is beta hydroxybutyrate, and you also have acetoacetate. This is then in turn carried to various organs such as your muscle, your heart, your brain to be used as a substrate for energy. Now, what intermittent fasting also does is it also helps in the production and release of important factors such as FGF21. The ketone bodies in turn also activate several important transcription factors such as cyclic AMP, CREB, NF-kappa B, and BDNF in the neurons. It also reduces the upregulation of the mTOR pathway, increases mitochondrial biogenesis, increases autophagy. All of this in turn makes you more stress resilient. It will also improve overall metabolic health. So this is very, very important to keep in mind. If combined with caloric restriction, in turn, we are going to activate two pathways besides just this pathway. So very importantly, the redox signaling pathway, as well as we just spoke about, the neuroendocrine signaling pathway through cyclic AMP. If anyone can name what also does this, just one thing, I would remind you of metformin, which also works on the cyclic AMP, AMP kinase pathway, and therefore has some benefits of mimicking caloric restriction at the level of the cell. Now, another important pathway that is in combination with caloric restriction is the sirtuin pathway. The sirtuin pathway then activates PGC1 alpha and the FOXO proteins. All of these collectively have very beneficial effects, especially at the mitochondrial level, improving your health and stress resistance. So I'm going to keep it simple. We also know through several studies now that intermittent fasting can help reset the circadian clock, giving you a better sleep, as well as improving the non-obese gut microbiota, which will use your nutrients more effectively and cause metabolic regulation to prevent you from getting these end organ diseases, namely obesity, type 2 diabetes, cancer, and CVD. Now, this is over here, again, a complex slide, but I'll just focus on this one part. This sort of tells you at what time of the day. For example, it says highest risk of myocardial infarction around this time, between 10 to noon, highest probability of death at 6 a.m. And if you can reduce the load on your body by intermittent fasting or just giving some break, it doesn't have to be 16 hours, 8 to 10 hours, you will improve, this is the term, the circadian coordination of metabolism and energetics, and improve the way your body can perceive stress. So you might have better chance of improving your age and longevity if you can somehow control what goes into your system. Therefore, what is proposed that it's simply not in caloric restriction, which usually gets coupled in, when people are doing intermittent fasting. There is the flipping of a metabolic switch. In the short term, it helps you in improving your overall health with weight loss. In the long term, however, if you continue this beyond 12 to 14 weeks, you might have improvements at whole gut level, healthy microbiota, improved lipid metabolism, and thereby emerge as a more resilient and disease-resistant state. So now let's see how does this translate into clinical data. We know that bacteria, yeast, worm, and mice had extended lifespan when they were subjected to fasting. We also know that Drosophila mosquito, when all the caloric restriction studies started, also lives forever. Now, monkeys, who are a little bit more closer to us as primates, there are two big studies, when the University of Wisconsin study and the National Institute of Aging study. However, they conflict results. The University of Wisconsin study showed a positive effect on health and survival of the monkeys. However, the NIA study showed no significant reduction in mortality. So now I'm starting to show you the pros and cons. Is this because there was a difference in the daily caloric intake? When did we start the intervention? Early, late? The diet composition, genetic background. Remember, how long we live is also determined by our genes. Sex, are you male or female? And these might explain if caloric restriction will work on some or not. So a genetic study might be something we need in the future. Again, the Okinawans. So I bring to you the Okinawans who live on the island of Okinawa, just off of Japan. And we know very well that they live, the average age is 60% higher than even the Japanese who live on the main in Tokyo or something. Secondly, as they get older, their metabolic profiles seem to get or remain better, and they mimic caloric restriction. So we know from the Okinawan study, we have a real lifetime surviving population, that this might work, and there is something to be understood, and the signaling needs to be understood. So moving on to something we see in everyday practice. What is the effect of intermittent fasting on weight, metabolic syndrome, CV risk factors, and diabetes? I bring you a nice review article by Dr. Samuel Dogogo Jack, and you can access this at Diabetes Spectrum, pretty recent from 2020 last year. Combining caloric restriction and intermittent fasting, what happens to diabetes? Oh, one slide is not seen. Maybe it's coming up. So first, let me just talk to you about in BB rats, because most of our data actually started off with intermittent fasting in rats and rodents and mice, and rodents seem to do better than the mice. So over here, in group 1, who were controls, about 80% became diabetic. Group 2 had 40 BB rats, and these are biobreeding rats. Food but not water was withdrawn to about 24 hours twice a week. So this is a 5-2 pattern. And only 50% became diabetic, so a significant drop. And in the group 3, food was withdrawn every 24 hours. So alternate day fasting, and 52% became diabetic. So that's amazing, is that there's a significant drop in that conversion to diabetes with the alternate day fasting and the 5-2 pattern. So sorry, this is going back to in human studies, what we find is whether we do intermittent fasting or you do consecutive day fasting, that's what is being called as continuous fasting. And we are looking at the effect on weight loss and A1C in some of these studies, and weight loss and hypoglycemia prevention also in one of these studies. What I want to just point out to you, that in most of these studies, there is a good significant weight loss. So let's just look at these 4, which have fasting versus control, or intermittent fasting versus continuous. So all of these methods seem to work. However, if you look at the effect on the p-value for A1C, you can see that it's not consistent across the board. The p-value is significant in this particular study, but is not very significant. So yes, it works for weight loss, but we are not very certain if it works for simply A1C reduction. Now, Dr. Williams and colleague, what they did is, in addition to intermittent fasting, they also introduced a day of very low calorie diet versus 5 days of very low calorie diet. And what you find over here is when they did this, the A1C drop is much more significant, 0.91 and 0.71 versus the 0.23. So maybe combining caloric restriction with IF works better is what I'm suggesting over here. Overall, looking at studies that we have for intermittent fasting and human metabolic health have also looked at CV markers and other inflammatory markers. So what you find, and as you can see, they're all very small studies with less than 100 participants. So these are just suggestions, and much longer term studies are going to be needed. So again, from studies of alternate day fasting, the weight change is usually seen in most of them. We also don't see a huge effect on cholesterol in most of these studies. However, there are some significant changes in inflammatory markers in some studies versus others. So time restricted.
Last 1 minute, please.
Perfect, yes. So again, similarly, alternate day fasting versus weight loss in normal weight and overweight subjects. I've shown you so far obese and type 2 diabetic. What's interesting is that over here, the dietary intervention of alternate day fasting also seems to work in subjects who were normal weight, and you can see they had a significant weight drop and significant improvement in their triglyceride levels, but not in their overall cholesterol levels. Just quickly, intermittent fasting has also been known to delay the onset of progression of Alzheimer's disease and Parkinson's disease. It works on cancer by probably, again, not through caloric restriction, but through mitochondrial scavenger system. So practical considerations, how many hours is it for all, and what should you do? Should you also do a macronutrient manipulation? So in this particular study, they looked at 4 hours versus 6 hours. And what they found is if you restricted yourself, the weight change is not much different, whether you eat for 4 hours versus 6 hours. However, what's interesting is that certainly there was a huge drop in the fat mass. There was improvement in markers of CV risk, such as systolic blood pressure, diastolic blood pressure, LDL cholesterol, HDL cholesterol, and also in the inflammatory markers within a 10-week period. And similarly, now when they combined this with a low carbohydrate diet, the results were even more highly pronounced. So this is important to know that if you can achieve a body weight, this over here of about 5.5%, you can see the fasting insulin levels go down, fasting glucose levels remain the same, but this is important marker that you're improving insulin sensitivity. And just to kind of give an idea is that in this particular study, they looked at incorporating what we call a pesco Mediterranean diet, because we know a Mediterranean diet is important for CV risk reduction. What they suggest is we need to still get to the bottom of all this as to, is it simply the intermittent fasting, or do we need to really have larger term data? So I encourage physicians, dietitians, nurses to come together and create a metabolic unit or a metabolic clinic. What you can do is you can start slow. In the first month, we can start with either a time restricted zone, then a 10-hour feeding, 8 hours, and then bring them to a 6 hours. Generally not necessary to go below the 6 hours. Or if you're following a 5-2 intermittent fasting pattern, on the restricted days, you can start off with 1,000 calories and then slowly take them to 500 calories 2 days a week with good documentation of what is happening to all their parameters. So yes, intermittent fasting has beautiful benefits that we have learned so far, but mainly from animal studies, affects all of these things that we have just looked at. We know that most of these have a metabolic and cardiovascular common soil. So if we can identify agents such as metformin, such as sirtuins, PGC1 alpha activators, which can mimic intermittent fasting, that might be the magic bullet we are looking for. And of course, the cons are hypoglycemia prevention. Difficult to take our patients from this to this if we ask them to give up certain meals a day. Physicians are not trained to do this, and long-term human data is not available. So I bring you back. What you could also think the benefit is that if you do intermittent fasting, you might become the CEO of a big company of Twitter. If you find it difficult, just maybe name your daughters as Jennifer. Lastly, most of us know this man, and I have known him for 1/3 of my life for the last 15 years, and I have only seen him eating one meal a day, which is dinner. I've never seen him eating throughout the day. When we were fellows, we used to just be eating. So Dr. Ralph DeFronzo has defined a lot of the pathways for caloric restriction, and he believes in eating one time a day. So if it works, maybe it will work for us. Thank you very much for your attention.
Thank you, Richa. That was interesting. On intermittent fasting, you laid out all the facts. Now, we open the forum for questions. Do we have something in the chat box? And I have a few because, or anybody.
I have a question, Richa.
Yes, go ahead.
Yeah, so my question is, do you lose only fat mass, or you end up losing also a muscle?
Yeah, so there is the loss in lean mass was insignificant in most of these studies. And again, bear in mind, the largest study we have is with 60 patients in each arm. So these are not large human trials that we have. In fact, dietitian Valardi has done a lot of these trials using different patterns, different methods, and they have shown beautiful effects with even 2 hour, 4 hour, 6 hour windows. The loss in lean mass was not significant because they do maintain 30% protein intake.
Thank you. Thank you.
Any other question, or I can ask a question? What about abdominal gut?
Yes, so unfortunately, we don't have, we are as Indians so programmed, and I think it's a great tool-based circumference. So I did not, if I go back to one of the slides over here, is that definitely, let me just, if you look at the, Yeah, so if you see over here, the fat mass, lean mass, it will kind of tell you that the lean mass, Meena, to answer your question, this was one of the best studies I thought I could look at.
Yes.
The lean mass does not go down and visceral fat mass does go down. So the waist circumference, I would assume, goes down. And
Yes.
that would be an easy way if we were to do, and we should design an Indian study. Sure.
It would encourage people as saying that, oh yeah, look, your waist circumference would go down if you try and do intermittent fasting.
And it's cheap. You don't have to spend any money on not eating for
Yeah.
a couple of hours. So as Dr. Parth Kar mentioned on my Facebook post, that most applicable for India because it's free.
It's free. And is there any other question? So I have another question. Do you recommend normal people as a way of a healthy lifestyle to do intermittent fasting?
Yes. So I also showed that in one of the slides is as to who can do it. And this is a study looking at alternate day fasting for weight loss or for metabolic health in normal weight and overweight subjects. So what's going to happen in this particular study done again by Dr. Krista Varadi, as I mentioned, she's got beautiful studies. They allowed in the alternate day fasting, the patients only consumed 25% of their baseline energy needs. So they did not restrict it to most of the other studies in alternate day fasting is 500 calories or it's a complete fast. So you'll have to select. Yes, you can recommend it because in this study, what they found is at the end of the study, there was weight loss, almost a significant weight loss of about 3 kgs compared to baseline, 6.5% as you can see. Secondly, what happened is the fat-free mass also goes down somewhat, but the fat mass goes down significantly. The fat-free mass did not go down significantly. So we know this will correlate into glycemic or other metabolic health control. Lastly, as far as CV risk markers goes, what we found is that in this particular study, triglycerides and the LDL particle size, triglycerides went down, LDL particle size increased. What I would hypothesize how we look at this is, so for me, understanding at my fellowship research is in mitochondria. So whenever we used to do these kind of studies and patients came in fasting, it was always amazing to see because we had their baseline data. Their mitochondria, even after a 12-hour fast, showed more ATP production and more mitochondrial density if they had fasted for 2-3 days. So when you are eating less carbohydrate, less protein, less fat, less nutrients going to the mitochondria, thereby you are not overwhelming the capacity of the mitochondria for all the oxidative pathways. Scavenger free radicals that are created have to be cleared by superoxide dismutase. Now you also have SOD. So glutathione and liposomal glutathione has come into vogue simply because of this as a scavenger mechanism. So another thing that people are doing. So yes, as a way of healthy lifestyle for a lot of normal weight, metabolically healthy people, certainly. I do think that's a great way.
It's a way forward for good metabolic health.
Yes.
So in that way, in terms of its benefits, what we see and the data which you presented. Is there any other questions? And
Dr. Rusha, Dr. Shekhar here.
Yeah, there. Yeah,
Okay.
over to you, sir.
Have you looked at sagittal diameter of the abdomen as a very, very important marker? Because there is no inter-observer problems that occur as we look in the waist circumference in the rest. It can always, and I have not come across a lot of people looking at sagittal diameter of abdomen as a very good marker.
No, I agree with you. In the studies I looked at, I did not find anything. And, like I said, the human data is highly limited, but I will specifically do a search to see if there is somebody who has. So even in the biggest trials that we have, the calorie study, which is a CALERIE, and from Dr. Valadi, who has done all the IF data, and some from we are going to hear Dr. Hamdi in a day or two. I did not find that term being used in the outcomes, so I'll look into it. Thank you.